Okay, so welcome to the ETF Regional Research Updates. This one is for Latin America and North America. So in a second, I will go through some housekeeping with you. So if I can draw your attention to the slide in front of you, to the very far left here, you will see a mute and unmute option. For the purposes of this event, could you stay muted unless obviously you are speaking as part of your presentation or the Q&A. Then over here, you have the participants, so you can see who's online with us. Obviously, if you want to connect with them, you can reach out and message them through the chat here. And then for this webinar, we have a fantastic interpreter who hopefully you should be hearing in the Spanish channel if you want to hear Spanish. If you want it in English, please stay in the English channel. Thank you. So a brief agenda of today's event. I'm Kerry and I'm doing the housekeeping. Then we're hearing from Brendan Cox, who will welcome the ETF project as a whole, who's a fantastic moderator for today. Then we're going to hear from Jaime, who will be representing Latin America. And then we'll be introduced to Maureen or Mo, who will be showing us, telling us about North America. Then we'll move on to the question and answer. So please feel free to put your questions into the chat and we'll field them out as we go. And then we'll finally hear from Brendan Cox, who'll give us our closing remarks. Okay, so I will now pass you on to the moderator, Brendan Cox, who is the Director of Policing Strategies for the Lead National Support Bureau. So thank you, Brendan.
Thanks, Kerry. Thanks, Kerry. I appreciate that. Welcome, everybody. Appreciate everybody's attendance today for our webinar on Latin America and North America on an update on where we are on the envisaging the future of policing. Just to give everybody a little bit of background on where this started. So GLEFA, the Global Law Enforcement Public Health Association, a number of us after the GLEFA has always been about pulling law enforcement and public health together and looking at public health initiatives that can help public safety and how we can have better community safety around the globe and how we can learn from each other and how that can actually travel across the world and how we can actually see how each other works and how we can adopt that in different places. And a number of us, after we saw George Floyd get murdered on TV, a number of us, the members of GLEFA, were on a string of emails talking through what we saw and what we need to do. There was a lot of ideas, and there still are a lot of ideas that are out around the globe about how policing can change and how public health approach might work. But I think a lot of us saw that folks were just throwing a lot out there and saying, hey, we'll just have mental health workers go to every single mental health call and not putting a lot of things behind it to be like, oh, how is that all going to happen? How are folks going to be able to do that? And I think folks were trying to figure out what's out there, what's working, what does it take to actually implement something different? What does it take to actually bring a public health response to public safety? Does that mean that, when you talk about the funding the police, does that mean the police just go away? That doesn't necessarily seem realistic to a lot of folks. How do roles change? What do things actually cost? What are the actual resources that you need? And what are the consequences of that, both intended and unintended? So we realized that we didn't really know what we didn't know. We didn't know what was out there. We didn't know what we could learn from each other. And we didn't know necessarily the context of that because we realized that we all live in different systems. We all live under different circumstances. But that also doesn't mean that we can't learn from each other. That also doesn't mean that we can't take something from one of our places of one of our countries, one of our places where we live in, and apply it to another place. Here in the United States, we have 50 states that many times act very independently, and we'll find things. I'll often hear, well, you might have done that in New York, but we can't do that here in Mississippi, and it'll be like, no, you actually can. We can learn from each other. So obviously we get that when we start talking globally. So as we started talking about how we can try to look at bringing public health responses to public safety and really trying to find out globally what we needed to do, we realized that we really needed to dig in and find out what that looked like and how we needed to look at different regions of the globe and do some research. And these webinars, today's the second of a 3-part series, are to start bringing that information back to our membership of GLEFA, back to other folks around the world, and to start sharing what's been found, but also to start getting feedback. So today we're going to have 2 great speakers, 2 great researchers start sharing what they've learned. And then we're going to open things up. We're going to talk a little bit about some different things we've learned, and then open things up to all of you, because we want to hear from you, certainly get some questions, but also hear from you about what you guys think. And what we've learned certainly already that I can tell you is that there are a lot of things that we don't know, and that we've also opened doors up into other places that we know we're going to have to go to next. We know that there's other pieces that envisaging the future of policing has not covered, and that we're going to need to cover. So you are all not here to listen to me just drown on about what we were looking to do and why we're looking to do it. You want to hear from the researchers, as I do. They found some really exciting things. So I'm going to turn things over to Jaime. So Jaime Arendano Sanchez Lira is going to be our first researcher. I'm going to give you a little bit of his background. So Jaime is a professor at the Drug Policy Program at the Centro de Investigación y Docencia Económica in Aguascalientes, Mexico. He completed his PhD in global public health at the University of California, San Diego, and San Diego State University. Studied political science and economics at the Instituto Tecnológico Autónomo de Mexico, and a master's in Latin American studies at UCSD. And the rest of his bio is on our website. For the Spanish-speaking folks on the call, I truly apologize about my Spanish. Mr. Schaefer back in my high school would shame me. I spent way too many of my educative years screwing around, so my apologies. Jaime, the floor is yours.
Thank you, Brandon. Let me share my presentation with my screen. Hopefully you can all see it. Yeah, perfect. Thank you so much, Brandon, for the introduction. Let's see. Like Brendan said, I'm a professor at the Drug Policy Program at CIDE in Aguascalientes for the last 10 years or a little bit more, really since let me recap, I think since 2005, I've been working in policing issues. First, I worked for a little bit as a chief of staff in the ministry at Quintana Roo in Mexico. And then I moved over to my graduate studies, where I've been studying clearly this intersection between police and public health, more about those barriers that police might create for people who use drugs to acquire harm reduction services. So looking at police as a risk factor for HIV among people who use drugs and other vulnerable populations. Today also here joining us on the call will be Sergio Maulen, who will jump later on into our discussion section. Thank you, Sergio, for being around, and also to Natalia Campos, who has been magnificent in helping us out. So just some background while we start talking about Latin America, and also want to acknowledge all the people from the region who is joining us. Thank you so much. Latin America, unfortunately, is one of the most violent regions in the world. Lately, we have seen a surge in homicides throughout the region that not only have a negative impact on economic development, but also make it more difficult to try to assess some of the topics that we were talking today. For example, opinion polls, and these are measured systematically through an organization called Latino Barometro, have found that in many of the countries, public safety ranks as the #1 problem for many of our citizens. Also, this has led lately to a wave of tough on crime actions on behalf of the governments, who think maybe that police reform refers more to increasing penalties and sentences for people, or also deploying more police or military forces to control crime. So many of our countries are also doing part of these actions, have many of the higher numbers of people who are incarcerated in our countries. I think Brazil and Mexico are like the 5th and the 7th countries in the world with incarcerated populations. Many of them, we also have to say, without sentences. And these are demonstrated in the lack of confidence on police. So for example, on this report that I'm showing here in 2019 from the Latino Barometro, we can see the trust of police for many countries. And we see an average that around 35% of people, when they ask, do you trust your police officers, they answer a lot or some in there. And you have a variability among police trust from countries ranging on the top from Uruguay to Venezuela being the lowest, including Mexico right there. So this talks that there's a clearly lack of understanding between our citizens and the police or public safety institutions. So what have we done throughout this study on talking about the future? Well, we tried to look into the programs in 3 broad categorizations. One, which is the traditional policing response. The second one is alternative to non-police responses. And finally, these police and civil society collaborations that we will show in later on in the conversation today. As for the first category, policing response, these are initiatives that are traditionally centered around policing responses. Most of them are community policing. Community policing became a really trend towards the 90s, as many of the countries were coming out from, in some cases, dictatorial or non-democratic status. And these include, for example, the really famous quadrant deployment of Chile. And some of these have adopted also, for example, actions from the United States. So some of the information technologies to identify hotspots and trying to create more of a preventive action of policing than to reacting to crime. And in some of these cases, they had trying to integrate, just as community policing ethos is trying to bring us, this talk between citizens or the community and the police to try to take the needs of the community in hand and trying to be more proactive to their particular conditions in several areas. And I chose to amplify here 2 places from the same country. Why? Because one of them, for example, and this is in Brazil, was a program that it was really popular in other places, which is the pacifying police units in Rio de Janeiro. They started around 2008. And the other one, the community security bases, they started a couple of years later in Salvador de Bahia. The difference among them is that Salvador de Bahia was really embedded within a bigger talk of Pact for Life, or this strategy to try to reduce violence and homicides within communities or impoverished communities in the state and particularly in the city. So what these have is they try to understand that police management units, so you put police bases throughout different spots in the community to try to reclaim the territory. And then after that, the police try to do walkouts in the community to have to establish this conversation with the citizens, and then bring over a wave of other social services, including healthcare. Ideally, one will expect that these programs reduce violence, which is exactly what happened, for example, the UPPs in Rio de Janeiro and Salvador de Bahia. But unfortunately, what we have seen is that these actions, after a while that they were undertaken, start to decrease the level of success. One part of these cause is perhaps the economic troubles that Brazil has been living in the last couple of years. That then led to a decrease in the number of police officers allocated to these security bases or police units. Also, what we have seen in Brazil is unfortunately a comeback to a tough hand strategy. So I don't know if some of you saw recently, there was this big operation in some of the favelas in Rio where the police shot 22 suspects. So this all goes against the idea of community policing. However, these programs started and for a moment help us examples for other places around the world, particularly in Latin America. But we also try to focus on alternative to non-police responses. And here we try to focus more on harm reduction, in youth and violence prevention, and social cohesion programs. So, for example, we have this program that is just started recently in Mexico City, in Iztapalapa. And once again, I'm showing cases from the same country just to see how within the same country we might have some success cases, but also failed experiences. So in Iztapalapa is a new model for substance use people that needs care in the city. In particular, this is a borough from Mexico City that is trying to shift the understanding of looking at substance use rather than a criminal problem, a health problem. So you have these centers where you can have access to safe supplies for harm reduction, also to community workers, to prevention, and it works directly with the people. The first project started almost a year ago, and up to now, they have created 10 centers. Unfortunately, COVID-19, as you all know, has hit us hard, and that's part of what we are doing in this virtually. These restrictions meant that they can take of less people because of the restrictions, so social distancing. And we're still trying to understand the programmatic alignments of the program. And one particular issue is whether the program will live longer. This is not the unique program in Latin America. There are other programs, for example, in Honduras, we have Centros de Atención para Jóvenes, which is a youth attention centers where the idea is that they offer a hotspot, a spot for the communities to have other activities similar to what these UPPs or other bases comunitarias had in mind, right? That is, first, you have a space, a safe space for the community to provide an array of services. Other kind of projects that I would see, for example, in Mexico, is one that I had the possibility of collaborating, which is called Escudo or Shield in the city of Tijuana, Mexico, where we provided an occupational safety and harm reduction training for the local police officers. So this was a train-the-trainers model where we were able to give a 3-hour class to almost 2,000 police officers, but also that offered the opportunity to create an evidence program funded by international organizations such as NIDA and the Open Society Foundations, where we were able not only to train them, but to follow up for 2 years a subset of those police officers and trying to see if we can assess changes in knowledge, behaviors, and attitudes towards harm reduction and attitudes to people who use substances. Unfortunately, once the administration changed, this program was no longer continue. And then this is where we start seeing some of these consequences, and that we will see in the challenges section, where it's being common throughout the region that these programs will cease to exist if we see a change in political management or even just a change in police management. And this is something that is common throughout the region. And finally, and I want to say that we have several members of this organization joining us today in our webinar. We have some police and civil society collaborations, and we wanted to focus ourselves in Red Sex Latin America, which is an initiative for female sex workers that offers police trainings directly given from them to decrease stigma, discrimination, and institutional violence, which they are exposed to every day through their work along the region. This program first started in Honduras, and I think that something that is really interesting from this approach is that it has been able to expand for over 10 countries throughout the region. And also, what is really interesting about this model is that it is a bottom-up approach where they have led the design, the execution, and the presentation of these sensitization programs with a first-hand advocacy. Obviously, these programs were also helped funded first through international organizations. Sorry, I think there's an echo there. And then they have been able to prove to decrease stigma, discrimination, institutional violence. So what we want to emphasize from this is this collaborative work between the sex workers and the police officers, but also, and something that is really important, the publication of reports and best practices. This is what has allowed some of the replication from where it started in Honduras to other countries throughout the region. And this is also where we need to put attention on why maybe it has not adopted in all the countries. I am in Mexico, and unfortunately, before I started working in this project, I didn't know the Retrasex project and the utility that might have to an area, for example, the city of Tijuana, that has a great amount of sex work in the city. So, for example, up to date in Honduras, it has been able to provide training to more than 4,000 security personnel and developing a protocol for police operations. So what are some of the actors and stakeholders that we've been identified? Unfortunately, there is no clear one-for-all strategy. There's no one single driver for the project. But what we have seen in this case for a long sustainable project, and I mean this because Retrasex has been going for almost more than 10 years, and they have already a publication on some early achievements. It has been successful thanks to donors, international donors, but also peers who take over the ownership of the program. And that way it can be, or it can last longer, and it can be institutionalized. And I think it's clearly thanks to a unique ability to be replicated in other countries. Some of the challenges that we have seen, unfortunately, some of the projects are kind of like shooting stars. They're beautiful, but they go really fast and they get out of our region really fast. So for example, we have the Open Arms in Brazil. There was an initiative in the city of Sao Paulo, which was meant also to provide an alternative for people who use drugs in the city downtown, most famously known as Cracolandia, and where the program will provide a stipend for people who use drugs. And when the political management in the city changed, it passed from, for example, there in 2016, to providing services to sending over the police to vacate the people who live in that area. Similar to what happened in Camats in Colombia, in Bogota, which are also attention centers for people who use substances, who were sponsored by the city hall and who were also deemed as an interesting case study by the Inter-American Development Bank. But when the political management passed from one party more from the left to one to more center-right, it meant that the program not only ended, but a similar strategy where it was the vacate that area, a little bit arguing this transformation of public spaces. One of the other, unfortunately, problems that we have in the region is the corruption and the lack of trust in police and in public safety institutions. This creates, unfortunately, a bad understanding between the citizens and police. There is no trust between police and the citizens, and this can affect the initiative of some, or the results of some of the initiatives. We can see this, for example, in Retrasex or in some other proximity policing projects, not only the ones that we mentioned in Brazil, but their replication in other areas like in Nesa in Mexico. So these high levels of violence also have led to organized crime being sometimes involved or being part of the security forces. We have seen this, unfortunately, lately in Mexico, where several of people who have disappeared have been done by security forces themselves. So there's a lack of transparency and accountability in police forces in the region that is contributing to human rights abuses, and that proves challenging when we're trying to understand police reform and a path forward. And this unfortunately had led to a backlash where some of the governments then think that it is not the police, the one that must be in charge of public safety, but maybe give it the hand to the military. And this has been the case, for example, in Mexico or in El Salvador, where they have led the police to conduct raids against organized crime, and now also against just crime in general, that goes against the idea of having police at the center and already have militaries conducting crime prevention strategies. One more challenge is the stigma around certain vulnerable populations, either be through sex workers, people who use substances, or even LGBTQ citizens. So this is something that we also need to fight against. Trainings have perhaps proven to be a little bit of the right track, but we need to find ways to implement it throughout the region. And unfortunately, there are not enough public resources to make this happen. Some of these cases have been brought in through international donors. And once the initial wave passes by, then we are in trouble of trying to find out our own money to implement these changes. Many of the violence prevention strategies throughout the region, and particularly in the Central American region, has been passed through the USAID initiative or through the Inter-American Development Bank, and then, or for example, through the Global Fund to fight HIV and hepatitis. And once these international funders leave, we have been faced with the prospect of ending the projects because there is not enough resources to continue in them. And then finally, something that it was also showcased in the last webinar, a lack of evaluation and systematization of programs. It is not only necessary to continue this in the long run, but we need to show the evidence for policymakers, because when they change, we need to show them with with evidence, what are the results of our actions have been and why the necessity to continue with them. So this, I think, is something that perhaps we'll see all along several of the regions, where we can pass on best practices through the systematization of programs, but also to show them through strict evaluations what the results of the actions might be. So with this in mind, I would like to thank my other collaborators, Sergio Maulen, Nora Rodriguez, which just joined us recently and who is a retired police officer from Colombia, and Natalia Campos, who is an amazing researcher, coordinator, who is helping us throughout all this way. And with that, thank you so much, and I'm happy to answer your questions while we engage into the conversation.
Thanks, Jaime. I think it would be great to get your colleagues involved in the conversation, and I think that was a great presentation, and I think that showed not only the work that you guys are doing, which is pretty amazing, but I think it's going to also show a lot of the challenges that we are having across the board. I think it will show some of the like challenges as well as some of the differences. But I know that one of the things we're seeing, as you guys are in Latin America, we're seeing in North America, is this spur of violence, and the violence is driving some of the progressive movement of changing policing back into this feeling that we have to get away from this public health response and go back to a more punitive response after we've made some strides into going into a public health arena. So I think certainly in CLEFA, I think we have to take into account, how do we make sure that we are able to continue to highlight that a public health approach can work, even in terms of reducing violence. And I think we have to always look at things in that perspective of realizing that we're not just talking about mental health and substance use. In my job in law enforcement assisted diversion, we divert folks that have unmet behavioral health needs, live in poverty, or homeless, and are usually committing crimes due to substance use disorders and things like that. But there's also amazing programs that do work around violence, and certainly my past work in policing, we had some great partnerships with folks that were doing violence outreach, and I loved being able to turn to folks that were on the ground and call and say, hey, we just had a shooting in a certain area. I didn't love having the shooting, but it was great to be able to call somebody and say, we just had this shooting. We want to make sure there's not retaliation. This is what the information we have. Can you guys go to work and pull your magic and to have things quiet down? Because there were folks with lived experience and folks that certainly had more legitimacy in the community than I did. To be able to go do that work, that's really important. So I think we have to be able to highlight that. And I also think we need to make sure that as we're doing this work, that we're able to highlight to the folks that are building the strategies these days, the on-the-ground strategies, to not lose focus of that yes, there's pressure and immense pressure on people, on political leaders, on law enforcement leaders, to make sure they're responding to the surge in violence, but that it can't be with a heavy law enforcement hand. You can't throw that net out and catch everything. You have to remember that there are partners on the ground that can help out. So I look forward to the conversation a little bit and catching up with that. So our next presenter is Maureen Mcgall. Mo is the Chief of Staff for the Policing Project at NYU Law, where she oversees the national efforts to improve accountability and transparency in policing. She joined the Policing Project from the National Police Foundation, where she led the nonprofit's research, training, and technical assistance efforts as the Director of National Programs. And prior to joining the National Police Foundation, Maureen spent a decade with the federal government in various roles with the U.S. Department of Justice and U.S. Department of State. And there is more to Mo's resume, and just like I said with Jaime, that can be found on our website. But without further ado, Mo, you have the floor.
Excellent. Thank you so much, Brendan. And as Brendan mentioned, I spent a large amount of my career with the federal government, and you're going to see that when you see how boring my slides are. Jaime, you really set the bar high, but it's going to be a very bureaucratic, visually disappointing presentation. So I just want to make sure everybody's expectations are set. So as Brendan mentioned, I'm the Chief of Staff at the Policing Project at the New York University School of Law, and I'm thrilled to be having this conversation with y'all today. First and foremost, just a huge thanks to Nick Crofts and Melissa Hardeen at GLEFA for their tireless leadership in this work. Big thanks also to my fellow team of researchers here in North America. And last but certainly not least, to Tim and Carrie at Innis for making this and so many other webinars and communication strategies happen. I can't seem to navigate across the 3 time zones we have here in the US. I cannot imagine what it must be like for you all coordinating this work on a global scale. So kudos to you. You're a well-oiled machine for sure. As I mentioned, I'm with the Policing Project. We are a small, but we think sort of mighty nonprofit out of the New York University School of Law. One of our primary focus areas is around reimagining public safety. In the US in particular, we rely on our police to just do way too much. We send them out to handle social problems for which they're not equipped or trained. And then we sort of wonder why we have a lack of improvement in community outcomes and an over-reliance on force and enforcement. So what I and others who are pursuing this reimagined public safety framework system are doing is trying to advocate for centering of community needs and minimizing the reliance on force and enforcement moving forward. That is, as you might imagine, public health strategies are going to be absolutely critical in creating that type of response. And that's why we were particularly thrilled when GLEFA invited us to be part of this research project. I wanted to start out with a little bit about the current climate in which these types of public health, public safety integrations are happening, because I think it's important to sort of understand the context in which these innovations are occurring, because it makes it all the more remarkable that this work is being done and is being done successfully. At the risk of fulfilling basically every stereotype there is about people from USA, I'm going to have a sort of US-centric presentation, but that's largely because our neighbors to the north in Canada are just a lot farther along than we are on a lot of these issues. So I promise it's not just another case of US centricity here. I want to talk a little bit about how we find ourselves in a position that public health and public safety integration isn't just the default. I'm assuming if you're on this webinar here with us today, you agree with the importance of public safety and public health integration, or at the very least, you see the utility of a public health intervention to improve public safety outcomes. That is not the norm here. Though for reasons we'll get into in a bit, I think there's a lot more traction than there used to be. So as I mentioned, we ask our police to do too much, and our police and our communities seem to agree in this regard. As funding for public health and other social interventions has gone down or has failed to keep pace with increases in demand, police officers become the de facto response for basically everything. And in the US, policing is highly localized. So there are no national basic minimum standards for things like qualifications to be an officer or training to be an officer. And in fact, you have some jurisdictions where you actually have to go through more training and more rigorous certification to become a barber than to become a police officer. And then we send these individuals out into communities to deal with these sort of complex, fraught, sometimes dangerous, continually evolving and compounding social issues with little to no relevant training or tools. And then we continue to be disappointed by the public safety outcomes we have. So that's certainly one part of the context that I think is important to keep in mind. Another part of the context is it's sort of a fundamental lack of understanding about the overlap of public health and public safety, both in terms of the systems and in terms of relevant outcomes, both for communities and at the individual level. You know, the more we learn from communities about what their public safety needs are, the more we sort of understand the extent to which the overlap is almost identical with what public health advocates have been pursuing for decades. I was on an expert working group recently with a particularly fraught community that's been through a lot of high profile tragedy and has significantly poor public safety outcomes. And almost to a one, when we started talking about community needs, they were naming things that were social determinants of health. You know, if you want to improve our public safety outcomes, give us access to good education. If you want to improve our public safety outcomes, make sure that we have safe and reliable transportation, that we have jobs and economic opportunity and access to affordable housing. You know, again, things that people in the public health sector have been advocating for decades. So the community is experiencing these needs simultaneously, but our systems are addressing them independently and at times are often working at cross purposes. And then another important note about the context, you know, and I was heartened a bit to hear Jaime say this. I mean, I'm sorry to hear that this is what it's like, but it's nice to know that we're not the only folks who are navigating these challenges. Is just a fundamental lack of trust between our police officers and the communities that they're meant to serve. We have had a spate of high-profile police killings of unarmed Black people and other people of color. We have a lot of data out there about the disparate impacts of the criminal justice system on Black people and other people of color. And the history of policing in this country is fraught. In some areas of the country, police departments actually grew out of slave patrols. And the problem of excessive force and police brutality has risen to a level that there are actually public health institutions in this country who are trying to pursue remedies to that problem from a public health perspective. Next slide, please. I don't want it to seem all doom and gloom because things are definitely changing. I'm guessing that many, if not all of you, have at least heard of the police murder of George Floyd in Minneapolis last May. That brutal incident ignited a bit of a national zeitgeist around police reform in a whole host of different areas. One of which is it significantly increased interest in the types of public health and public safety interventions we're talking about. People are really interested in models now where first response is grounded in responding to community needs and de-emphasizes force and enforcement. So there is more room to work, I think, than there previously was. The discussions have also shifted a bit to understanding that the most important thing that we need to center is community needs. And if we're going to measure anything, we should be measuring whether community needs are met, as opposed to, say, measuring public safety outcomes in terms of arrests or citations. That's not the point of the public systems. And there seems to also be a related growing acknowledgement that the most credible and important experts on the needs of communities and how best to meet them are the communities themselves. And they need a meaningful and in sometimes leadership role in redesigning the systems to better meet those needs. And finally, there does seem to be a growing recognition of the systemic racism that plagues not only policing, but all public institutions, and that the path forward must intentionally dismantle and protect against that inherent and oftentimes implicit racism that plagues our public institutions. All right, next slide. Thank you. So as I mentioned, things are changing. I feel like that context slide was a little bit doom and gloom, but I think now more than ever, we have a lot of reasons to hope that we'll be able to continue to expand this work. There is more traction to move away from the status quo towards a much more robust integration of public health and public safety systems. And what we're doing with the current research project through GLEFA is we're identifying existing and emerging public safety, public health integrations, and we're getting our arms around what research there is to support it, and also trying to get a better sense of what research is needed in order for these to be implemented effectively and equitably. So we're still in the data collection phase, but a lot of what we found is breaking out into these 4 categories, which I have listed here, and I'll go into more detail in just a bit. So the first is alternative models of first response, where a traditional police response is supplanted by a new model. This is probably where we've seen the most traction since the police murder of George Floyd. And these models might look like perhaps a co-responder where a mental health professional responds alongside a police officer, or an alternative response altogether, where a police officer is not dispatched in response to a 911 call, but instead a social worker is, for example. Second area where we're seeing some traction is around proactive interventions. So this is a bit different than first response in the sense that it's not police activity in response to a call for help. It's police activity as a result to the fact that they're so omnipresent and connected to the community. Maybe it's a community education component, maybe it's connecting communities to services proactively. And in some cases, it's even sort of shifting the police response to including public health responsibilities and serving the community. The third area is around pre-arrest diversion, police diversion, and that's where an individual can be directed to necessary treatment as opposed to arrested. This has the sort of effect of treating underlying needs and keeping people out of the criminal justice system where their needs simply will not be met. And finally, this area is the newest area for our research. This is around practitioner-focused public health responses. I honestly forget which of our North American researchers made this brilliant point. Brendan, it might have been you actually, but we've talked a lot about public health, public safety integration for serving communities, but we haven't really acknowledged the public health needs of the practitioners working in the system and how public health interventions might support them as they fulfill their mission. So like I said, we're in the early stages of that, but I'll talk a little bit about that as well. All right, next slide. So as I mentioned, the first area where we're seeing the most traction is around alternative models for first response. Traditionally, if people call 911 for help, they get the police and only the police, but research has really compelling evidence that so many of the reasons why people call 911 have nothing to do with an issue around force or enforcement. So some jurisdictions are addressing this by launching those co-responder models. If a call comes in, the call taker identifies the call as having perhaps a mental health or behavioral health component, and they dispatch a unit that is actually a partnership between a law enforcement officer and someone in behavioral mental health, maybe social work. Oftentimes they actually co-respond in a cruiser. And this is particularly promising for a host of reasons. I'm sure it's abundantly obvious, but one area where one reason why we're particularly interested in seeing how this works out is that research shows that 1 in 4 people who are shot by police are exhibiting symptoms of living with a mental illness at the time. And so we're really looking forward to seeing if co-responder models in the presence of mental health professionals on the scene might actually over time reduce the number of instances of police shootings. There's a really great example of this out of Ontario, Canada, where they partner a mental health crisis worker with a police officer, and they respond to 911 calls that seem to have some type of mental health component to them, or behavioral disturbance, or even substance use disorders. As I mentioned, another way people are responding in alternative ways is to just stop sending the police when they aren't needed. It could be a social worker, mental health professional, behavioral health specialist. We have a very high profile program that's shown some pretty significant success here in the US called CAHOOTS. It's let's see if I can get this right. Crisis Assistance Helping Out on the Streets. It's out of Eugene, Oregon. It's actually been in place for decades. And it is a 24 hours a day, 7 days a week mobile crisis response unit. And it responds to everything from behavioral health crisis, mental health crisis, substance use disorders, and even poverty and homelessness. And these teams not only stabilize the situation, but they assess the needs of the individual with whom they're interacting. They refer them to services, and oftentimes they even transport them there to ensure they have access to what they need. Another area, and this is particularly promising because it's a little less resource intensive, is improving training to police officers. So it is very likely that a police officer on patrol will, in the course of their duties, encounter someone who is in the midst of a behavioral or mental health crisis or substance use disorder. So there are a lot of departments out there that are exploring specific training to improve their ability to respond to individuals who are dealing with those types of challenges. So the officer dispatched is better equipped to handle these types of things in the absence of a professional, like a mental health professional or behavioral health professional. And then one thing that I don't have on the slide that I'm just starting to learn more about that I think seems very promising is anonymous databases where family members or guardians can call a police department and alert them that someone living at their address is living with a mental health disorder or behavioral health challenges or substance use disorder. So that way, if police are dispatched to the scene, they either know if they've got a co-responder available, they need to send them along with them, or they need to be mindful of what they're walking into. And so they just have a little bit more information about what they need. Those databases are, of course, completely voluntary and extraordinarily confidential. All right, next slide. So I did want to just raise a couple of flags about the alternative models to first response. So like I said, they've gotten an enormous amount of traction, particularly since the police murder of George Floyd, and they are incredibly promising. And in some areas, they've been proven effective. But I wanted to flag a couple of things just because the rollout and implementation in some jurisdictions has been very quick. And there are still a few things that we just need to know in order to ensure that these programs are implemented in a way that's effective and also equitable. So one flag is just that systemic racism is present in all public institutions. And, I think sometimes when people have these conversations, they assume that by removing things from the purview of the criminal justice system and placing them in the purview of the public health system, that it will solve the disparate impacts problem. We're seeing as recently as the public health outcomes of the pandemic, particularly here in the US, disparate outcomes exist in public health as well. So it's going to require a lot more than just transferring which system is handling these types of crises in order to address disparate outcomes. Another thing is around complexity around risk determination. These alternative responses are only going to be effective if a call taker and dispatcher know at the time of call whether police is needed or not. And there's inherent risks of getting that wrong, right? It's extraordinarily risky not to send the police if they are needed in a situation, and it puts practitioners at risk. It's also risky to send the police when they are not needed, and that's part of the problem that we're trying to address now. So we need a lot more research to support dispatcher decision making. Another area that I think sort of deserves a little bit of attention is around time bound of response. So as I mentioned, police are the de facto responsors because they're the ones that are available 24/7, and that any alternative models that are truly going to be available around the clock will require significant funding and is just a very large resource draw on a jurisdiction. So we just need to be cognizant of what we expect our cities to be able to pay for. The other is practitioner implications. So a lot of these conversations are happening at sort of this national macro level and don't include people on the line. So for some police officers, they are drawn to this profession because of the social service components of it. And if you remove those components of the profession, who might you lose in the police profession? And inversely, many people are drawn to a mental or behavioral health profession, not because they expect to be on call at 2 a.m. to respond to someone with a weapon. So there just needs to be a lot more outreach done to the people who are doing this work on the ground to understand how to redesign these models in a way that sort of meets their needs as practitioners and professionals. All right, next slide. All right, a second area where we've seen a lot of traction is around proactive interventions. As I mentioned, that involves the police sort of leveraging their deep ties to the community to go out and either educate communities about available treatment, connect them to resources or services, and at times even serve in a public health function. Where we've seen that the most, I think, here in the US is around responding to the opioid crisis. It's interesting. In some jurisdictions, police departments have their officers carry something called naloxone, which is a life-saving drug for individuals experiencing an opioid overdose. And if a police officer is on the scene, they see someone with experiencing an overdose, they can administer the naloxone and likely save their life. There is some debate in certain jurisdictions whether or not using the police department to fulfill that public health mission is appropriate. But the reality is the police officers are often first on scene. Administering that drug is time critical, and in doing so, they're saving lives. So that is an area where there's still sort of an exploration and different schools of thought that are sort of navigating that space. Another area where you see this is around homeless outreach teams, and those are also replicating in the last year. Homeless outreach teams are partnerships of social workers, caseworkers, mental and behavioral health specialists, and law enforcement. And they proactively go out, particularly to homeless camps, to identify the needs of the people who are temporarily residing there and connecting them to stability and treatment services, including temporary housing. All right, next slide. A third area where we are seeing a fair amount of traction is around diversion and deflection. And Brandon, I hesitate to present on this slide because I know this is your area of expertise, so I'll try and do it justice, but don't hesitate to hop in here. So basically, this is the concept of police diversion. And this goes by a few different names that you may have heard, whether it's pre-arrest diversion, pre-booking diversion, deflection. A lot of them are achieving basically the same outcomes with the same sort of theory of change and philosophy. So the way it works in police diversion is if an individual is suspected of having committed a crime, and this is generally limited to non-violent offenses, of course, rather than going through the process of arresting and booking that individual, the officer connects that individual to community-based treatment if they have an underlying relevant need. So the officer would use a screening tool. They would try to determine the needs of the individual with whom they're interacting, and they would try to determine the extent to which the individual poses a threat to society. If the individual has a need for something like substance abuse treatment, and if the individual does not pose a threat to society, then the officer can refer that individual to treatment in lieu of arrest. If the individual does not have an underlying need, or if that individual does pose a threat to society, then the traditional law enforcement response is used. I should note too that if someone is referred to treatment and if, for example, they fail to check in, then they can still be arrested for the original offense. And one of the most popular versions of this model in this country, or probably the most prolific version, is the LEAD program, with which Brandon is associated. If an agency has a LEAD program, basically officers just exercise their discretion when they are dealing with a violation that's driven by an underlying and unmet behavioral health need. They can choose to defer the individual to a community-based harm reduction intervention, and the individual is also assigned a case manager. So the interaction between the criminal justice system, the treatment providers, and the case manager are all integrated, and the case manager ensures that any criminal justice actions are sort of taken mindfully in light of treatment plans and the time it takes to actually stabilize individuals. And that case manager will even be pulled in if there is an additional offense. So if somebody is in treatment, but they have another criminal offense, the case manager will be pulled in, and the treatment will be negotiated across the criminal justice system and across the community-based harm reduction intervention. This really maximizes the opportunity to affect behavioral change because, as we know, particularly with people living with substance use disorder, just deferring them to treatment a single time is not likely going to result in long-term behavioral change. These things take time and they take coordination, and LEAD does a fantastic job of achieving both of those things. All right, next question, or next slide. So the last, as I said, this is sort of the newest area of exploration for us, and that's around public health interventions as they are relevant to serving public safety practitioners. So in the US, and I imagine this is not unique to us, police officers are at significant risk of near and long-term negative health outcomes. They're at significantly higher risk of things like heart disease. Mental health crises are common. And in the US, police officers actually have the highest risk of dying from suicide than any other profession. And a police officer is actually more likely to die from suicide than from in the line of duty. So supporting the people who are serving our communities is paramount, and public health has a huge role to play in ensuring that that happens. I wanted to highlight a few areas where we're seeing some traction, but again, this is the newest part of our research and we'll probably have more to report in a few months. But there is a group of law enforcement officers out there. They also happen to be PhDs. Their names are Tarek McGuire, Obed Magni, and Sean Barnes, and they have actually partnered with a psychologist to research the shared exposure to trauma between police and communities, and sort of seeing if we can acknowledge that the fact that much of the trauma that police officers experience is the same trauma that communities are experiencing. Can there be a path forward to healing together in a way that sort of gets rid of that false dichotomy between the police and the communities they're meant to serve? I know they're working on a book that should be out at some point this year. I apologize, I don't have more details because they're not quite yet finished with publication. One thing that has been fairly common for a while, particularly in your larger agencies that are more well-resourced, is in-house psychological support, an in-house psychologist or counselor who's available at any time to officers who need to check in. There's employee assistance plans that support officers in receiving mental health support, even if it is externally. There has been a tension there, but there's certainly room for growth. And then finally, there is starting to be a growing understanding about the importance of building mental health resilience prior to the exposure of trauma. In many departments across the country, a lot of these sort of mental health interventions happen after an officer has been exposed to trauma. And at that point, the literature shows us it's a little bit too late to serve them, that it's really important that anyone who's going to be exposed to trauma, and it is likely that particularly when officers on patrol, they will be exposed to trauma, that they need to build resilience to that trauma well before they are exposed to it. So you'll see an increase in academy training, for example, that integrates mindfulness and mental health into the training curriculum and serves the officers before they're actually exposed in the field. Next slide. So that's sort of the top line of what it is that we're seeing. I know I took a bit of time and I want to make sure there's plenty of room left for Q&A, but I think sort of the top line here in the US is that there are a lot of reasons to feel hope. There's a lot that we still need to know, but there is a lot of traction and a lot of different avenues that we can use to support public health and public safety integration. And I'm really looking forward to continuing to learn from our partners around the globe about what it is we could and should be doing to advance public safety outcomes. So thank you.
That was great, Mo. Thank you. That was an awesome presentation, and it brought a lot of the things that we're going to talk about next, and then open things up to the folks that are attending to this as well. But I think you brought out some really good issues that I think we're trying to get to look at. And one of the things that I think everybody's kind of worried about, and in my everyday work, and you did a great job with LEAD. One of the issues I get worried about in work, my everyday work with LEAD, is that everybody wants to get the work done like immediately now. Like we want to get things instituted. So like I'll get a lot of times a call and folks will be like, hey, we started LEAD 6 months ago and we've got no traction. And it'll be like, okay, well, what are you doing? And folks will be like, well, we just told officers they could start diverting arrests and we told them to call this number and that they could just call us and do this. And I'm like, that's great. Like, I love the fact that people want to start trying, but it's hard work. Like the things that we're finding in Latin America and North America, in Europe, in Eurasia, like the things we're finding, like they're hard. They're not easy to do. And to have this collaborative approach and to recognize that no one field can take this all on. It's really hard work. So to think that through and to be able to get all the players in the room. And Mo, you brought up that fact about like kind of the line folks, like to have the officers at the table, to have case managers at the table, and the folks that are going to actually be doing the everyday piece of things. One of the things, and I just got lucky for the fact that it worked out in Albany when we went to initiate LEAD. I just got a stroke of luck in the fact I put out a memo to my officers and said, this is what we're looking to do. This is the process. And hey, I want your help in implementing this and building the policy. And I had a group of about 8 officers, from police officer up to a lieutenant, who said, hey, we want to be a part of that. And they built the policy. And they wound up being the folks that really went around to their peers and helped to really build off of that and be the trusted messengers. They didn't have to hear it from, hey, the crazy chief doesn't want us to arrest people for using drugs anymore and is okay with people not being abstinent. So all of a sudden they got to hear from their peers that, no, this was okay. And then they got to hear also from their peers. And Jim Pugel is on, who did this fantastic work in Seattle before any of us did it. They were able to go out and hear from Jim's people, you know, a bunch of other cops peer to peer, you know, yeah, this can work. Like, you don't have to believe in abstinence. You don't have to believe in harm reduction, but it's okay. It can work for us. And all of a sudden you see these changes. So this is all difficult work. It is not easy stuff to do. If it was, we all would not be in the boat that we are. So we need to all learn from each other. We need to all figure it out. And we need to be okay with pushing back on the folks that want to get this stuff automatically off the ground, to push back a little bit and say, just give us a chance. Because, you know, we do see all the different models and things that are in place. None of them are gonna fix everything. Lead and cahoots can work together, and in some places they do work together. And neither one of those is going to put each other out of business, and neither one of those is going to solve everybody's problems. So, like, we field, as the National Support Bureau, we'll field calls from folks either already doing lead or wanting to do lead, and then they go, well, we have cahoots here, or we have co-responder, we don't need you. And it's like, well, if you want us, we'll come, but understand that none of these initiatives are going to put the other initiatives out of business. Put me out of business as a chief police chief, and nobody ever could. But, you know, that's the whole thing, is we have to realize that none of us have the one answer. So let's try to figure this out together, figure out the best practices. And for the folks that are on this, that if you have not been a part of this before, make sure you get on GLEFA's website. The link is in Tim put the link in the chat, because that's what we're trying to find, some of the best practices, and recognizing that we're not going to know all the best practices. We have to build some of these, and that's why we know we have a project that has to go along. So Mo and Jaime, if you guys will, and if we can be joined by Sergio, Natalia, and Rodrigo, let's talk a little bit more about this. Let's talk about, maybe we can talk a little bit about the question around how do we make sure that the alternatives that we identify, or even the alternatives we build, how we don't wind up with a worse response, something that's more harmful than that traditional response. Like, I mean, just an example, like when I was a young cop, most cops answer the question, why do you want to be a police officer? When the internal affairs or inspectional services, whoever's doing the hiring process, say, because I want to help people. And most of them mean that. Like, that's what they mean. They don't say just because I want to throw people in jail. They say because I want to help people. And when I was a young cop, I thought that by arresting somebody for a drug possession, that I was actually getting them help, that putting them in a jail cell was actually going to help them out. I learned, thankfully not too far into my career, that actually didn't help anybody, that actually caused more trauma. But how do we make sure, like, these alternative responses, whether it's co-response, whether it's sending mental health professionals out, you know, we know that other systems are broken. Like, my biggest frustration as the chief, and Mo, you talked about this, about talking to a community group and about hearing all the different things communities were asking for. Like, I remember being the only people at community meetings were the police department. Other agencies weren't there, and hearing about things people need and knowing about the systems that are broken. How do we make sure, as we identify other ways to do business, public health approaches to community safety, is there a way to ensure that we don't bring something out that's actually more traumatizing than what we're currently doing? What are you guys' thoughts?
Go ahead.
I can jump in, but yeah, Jaime, go ahead.
No, you go ahead, please. You take this one.
So, I mean, at the risk of sounding like a broken record, I think there's two really important things that we need to prioritize. One is centering the voice of the community in these redesigns, and acknowledging that the communities are the experts in what they need and how best to meet those needs. And the other is to be really rigorous around measurement and evaluation, and be humble enough to acknowledge that if we are seeing either no effects or disparate impacts, that we don't have all the answers and we need to change. So I think those are sort of two critical elements we need to address up front.
Yeah, I think I want to link it with another conversation that we have on the chat. I think Mark is asking, how do we change the narrative, right? How do we, when we have, his question completely goes like, when we have invested by politicians in media on creating this narrative about what is bad, what is wrong, how can we discuss this component public narrative of communications. No, I think that's it's an interesting point. I think, unfortunately, we're seeing right now that the messages are really being simplified, right? That we are trying to understand everything with one single line and not trying to understand the complexity about many of the underlying conditions that create either violence or makes some vulnerable populations more at risk than others. And this is where I guess we should play judo with policymakers, right? Let me take the example of the Mexico. The Mexican president, even though that he is using a militarized force now to conduct policing, has always emphasized that he has these interests for reducing social inequalities. So we should take that message and then do our judo technique and say, okay, let us help you to make things better. Like if we prevent crime through some of these measures, then we can also implement these other diversion tools or other decriminalization. That is one of the other topics that is on the table, and go hand in hand with the measures that you are trying to promote. But also we need to be really strategic into denouncing some of the malpractices. So for example, stigmatizing people who use substances is really a bad decision, that it has to be shown in public, because it goes against trying to build trust with the communities that we're trying to serve. And Brendan, you also mentioned something during your question about whether negative consequences of some of the actions that we have done. And I think that in my particular experience, I think we have succeeded in creating or understanding certain issues as a public health topic. Let's take substance use, for example, as one of the main cases, right? We need to see substance use as a public health topic and not a criminal issue. However, some of the local politicians or some people who are in policy-making decisions understand this as, okay, then everyone who uses substances needs to go to rehab against their own will. And this is where we need to also understand the unintended consequences of our actions that sometimes might be our harm of the communities that we're trying to protect.
Yeah, absolutely. I think you guys are both right. I think you guys both hit the nail on the head. We got to continue to make sure we look at what we're doing, and yeah, we do have to recognize the harm that we've done, and make sure we don't continue to do it. So I'm going to turn to. We got a couple questions in the audience. I'll turn to the audience. Folks, if you guys have questions, definitely throwing your hand up from the reaction on your screen works. So Jennifer, you had your hand up first. You are good to go. Jennifer, if you want to unmute yourself and show your camera. And Elena, I do have you next. So Jennifer, if you want to go first, please go ahead with your question.
Thanks. I turned my camera on, but it's going to look like I'm lurking in the dark. It's just my camera that's doing that.
You're good.
So I run a peer advocacy organization that represents people with mental health substance use histories. And we've developed some guidelines on the development on alternative responses, which I put contact information for myself in the chat, but if you want details, but just to go over them very generally, I think it's very important that service users be very central to the decision-making in this arena, because traditional mental health services have also used force, and they've also used them in a racially biased way. So we can't assume that just putting people in the mental health system is going to give them an experience that's going to be lacking in force. We talk about the importance of community-based services that meet basic human needs and prevent crises in the first place, and that the alternatives for response to people in crisis include peer-run alternatives and peers working for community-based crisis services. We actually have some that we're working with the City of Toronto to develop the expansion of community-based crisis services. And right now we've put some community-based workers in the communications area so that when police call, or when people call police or emergency services, they can get somebody to talk to who's not associated with the police right on the spot. We think it's very important that when developing alternatives that there be peers involved in the governance of whatever services are funded for expanded alternative delivery, and that members of the communities that these services are located and be represented in governance as well, particularly Black and Indigenous people in Toronto. So there's just a few, I don't want to go on too long, those are just a few of the things that we think are important to ensure that we have alternatives that are actually improving the lives of people in crisis, not just sort of shuttling them out of public view into an arena which might also not serve them well.
No, thanks, Jennifer. I think that's really important. And we will make sure we have, thank you for putting your contact info in the chat, because we will make sure we have you, because we want to make sure we can include your initiative within the North American frame. It's really important we capture everything happening. And I really appreciate you bringing out including the community, because we certainly should not be trying to provide community safety and not include the folks that are most affected. And we truly believe that the community has a say in what's happening, and they can be the best guideline many times. If we're not listening to the community telling us what they need, then we're not actually doing our job, and not just listening to what they need, but having a seat at the table. I could go into all kinds of things that we do and lead to try to build community leadership. But that could be a whole nother webinar. But at the end of the day, what you bring about is really important. So thank you very much.
Great, thank you.
Elena, go ahead and jump in.
Listo, Elena.
Elena, if you want to unmute yourself, you are good to go.
Estás en mute, Elena.
El micrófono, Elena.
I think we might have lost her for a minute.
Sorry, no había.
Ya estás, Elena.
Perdón, no había atacado el... Bueno, soy Elena Eva Reinaga, la secretaria ejecutiva de la Red Latinoamericana y del Caribe de Trabajadora Sexual. En realidad quisiera decir qué más se puede hacer para realmente tener una policía que, en vez de matar a la gente, en vez de matar a las poblaciones vulnerables como trabajadoras sexuales, personas.
I think we lost her. Creo que te perdimos, Elena. Ya estás de regreso.
Tengo una muy mala conexión hoy, no sé qué pasa. Ahora me están escuchando, háganme así y yo te...
Sí, te escuchamos, Elena.
Si quieres quitar el video y a lo mejor el audio, sí.
Sí, pero saca el video, así se te escucha mejor.
Hola, ¿me están escuchando?
Sí.
Sí. Saca el video, Elena. Saca la cámara.
Ok. Voy a sacar el video, tiene razón, a ver si mejora. No, igual la conexión me dice acá que está inestable. Bueno, voy a volver a intentarlo, ¿sí?
Te escuchamos.
Soy Elena Eva Reinaga, soy la secretaria ejecutiva. ¿Ahora me escuchan?
Perfecto.
¿No?
Perfecto.
Sí, te escuchamos.
Sí, ok. Bueno, como soy la secretaria ejecutiva de la Red Latinoamericana, bueno, decirle qué es lo que se podría hacer sería la pregunta. Primero, aunar los esfuerzos, ¿sí? Lo dijo la compañera que habló anteriormente a mí, que hay que hacerle parte a las comunidades para realmente tener una policía que respete los derechos humanos, porque tenemos, por lo menos en América Latina y en el Caribe, policía que en realidad muchas veces no saben nada de legislaciones, tienen muchos prejuicios con respecto a las poblaciones, como a la comunidad gay, como a las trabajadoras sexuales, como a las compañeras trans, y por ende actúan con el odio, más que nada, ¿no? Muchas compañeras son violadas. En esta época de pandemia, del COVID, realmente habíamos avanzado bastante con la policía, pero hemos vuelto para atrás, lamentablemente. ¿Por qué? Porque hay países tienen, por ejemplo, hoy Chile tiene una cuarentena estricta, pero hay trabajadoras sexuales que tienen que salir a trabajar, necesitan sostener a su familia. Entonces hay policías que las hostigan, las insultan, les pegan. Entonces, lo que yo creo es que hacer capacitación con ella es una de las estrategias. La otra estrategia tiene que ser trabajar directamente con los Ministerios de Justicia y de Defensa para poder trabajar con la policía y capacitar a los policías que van a ingresar a la academia. Hay que ir más fondo, más abajo, ¿no es cierto? O sea, que cuando el policía salga a trabajar, realmente ya esté concientizado, sensibilizado, tenga en todos sus estudios el tema de los derechos humanos, saber la legislación, saber el tema de los derechos humanos, ¿no? Y cómo tiene que respetar. Digo, porque en América Latina el trabajo sexual no está penalizado ni nada que se le parezca, sin embargo nosotras somos perseguidas, violadas en los calabozos, chantajeadas, ¿me entienden? Entonces, por eso nosotras veíamos tan importante haber hecho el estudio de violencia institucional y luego del estudio hicimos lo que vendría a ser la sensibilización, porque muchas veces se estudia, pero luego no se hace la, digamos, la otra parte, que es la acción. Está bien el estudio para saber cuál es el panorama, pero también tenemos que hacer el tema de la sensibilización y la acción para cambiar la realidad. Lamentablemente estos 2 años, año y medio de la pandemia, estamos paradas con el tema de la policía, pero seguiremos avanzando. Y la verdad que gracias por la oportunidad y de vuelta. Aunemos la fuerza, ¿sí? No puede ser que haya uno en México, otro en Canadá. Me parece que sería bueno que nos juntemos e intercambiemos la buena práctica, pero veamos que también qué podemos hacer juntas y juntos. Gracias.
Gracias a ti, Elena. La verdad es que tu ejemplo siempre por habernos abierto las puertas para conocer más el proyecto. Creo que hay varias compañeras que están aquí, trabajadoras del proyecto de Red Trasex. Muchas gracias por juntarse con nosotros en esta llamada y creo que tienes razón. Es necesario no solamente dar capacitación a los oficiales que ya están en activo, sino que deberíamos empezar desde antes, ¿no? Desde el tema de la academia. Y coincido contigo, creo que el tema de COVID-19 ha sido difícil y que el reto es cómo volver a conectar lo que se seguía haciendo antes de COVID para que no se pierda ese avance institucional. Pero creo que tienes mucha razón, estas restricciones de COVID han hecho que muchas de las policías fueron utilizadas como un mecanismo de control social para el tema de la enfermedad, con consecuencias negativas como las que nos estás diciendo. Inclusive en algunos de los casos aquí en México, por ejemplo, ha habido personas que murieron a mano de la policía con el argumento de que estaban violando, también en Colombia, si recuerdo bien, Natalia nos puede decir, que estaban violando las restricciones de distanciamiento social. Entonces creo que es un balance dedicado. Voy a hacer 5 minutos para explicar a los que no hablan español muy rápido. I think what Elena was mentioning towards the end was not only that, well, thanks for the opportunity to be here, but something that I think we have not mentioned, which is the way that COVID-19 made some of these restrictions being imposed by police officers, and some of these policing tactics throughout Latin America and many other countries have resulted in harassment of vulnerable populations, such as people who do sex work, as Elena indicated, and the violation of human rights. And I was just replicating that this is true also in Mexico, where many police forces were used as a way to have social distancing measures, control in the countries, with negative consequences. Also in Colombia, we've seen it where many of the people who were detained by police with the justification that they were in violation of these public health measures, unfortunately ended up in some of the cases dying at the hands of police officers, ironically, in order to protect the public health of the entire community.
Jaime, if you let me, and she says several times, asking for working together. Several times she says, asking together. So that's an invitation of Elena to our group, and I think we have to take that invitation.
That's great. Thank you, guys. Gracias, Elena. Thank you. That was very, very helpful. So we are just about out of time. I see one more hand up, so I'm going to ask Mark to go ahead and pop on, and then we will close things out.
Thanks. Appreciate being able to sneak in a second question here. Hope you all can hear me okay. And excuse any background noise. So of course, thank you for the presentations, more so for the work. Definitely learning a lot from each of you. So thank you. My question, I don't want to go to the negative, so I'm going to try to flip this as a positive, hopefully. But my question's regarding the kind of so-called terror of error, right? Like when we talk about alternative approaches, there's so much fear that if we don't arrest this person, what happens if they go commit a crime, if they go kill somebody? This fear that, right, everything is framed under public safety. And then if it backfires, right? And unfortunately, that question is not, of course, asked of the current system, right? In terms of people being arrested and incarcerated, and then that leading to increased crime or recidivism. But this is, an issue that comes up a lot. I talked with a friend who runs a program in New York City around alternatives to incarceration. And there's a big fight in New York City about closing this notorious prison called Rikers. And they do supervisory community-based release. And he says, we need to get to a point when we're talking about these alternatives where we say, the detention, the punitive approach, like that there might actually be a moment where somebody goes and commits a serious crime that is part of this program, but that isn't a minority of overall, and it is worth the alternative to putting everybody in Rikers. And we need to kind of be direct about this potential risk because it exists, and dancing around it or trying to avoid it might just be setting ourselves up for eventual failure. So I'm curious your take on this question. Do we need to address this head on? Have you seen programs that have been able to kind of survive this fear of the blowback and terror of error if it has occurred as well? Thank you all.
So Mo and Jaime, if you guys want to go ahead, Mo.
Yeah, and Brendan, I'd love to hear from you too, because I feel like lead is the very definition of an example of surviving that terror. Mark, I really appreciate how you framed it, and I would even broaden it to an exploration of there's an assumption that if anything at all is against the law, the police are the people who can do something about that, not only in the current context, but in preventing it. And that's just not true. And we need to orient everyone towards what our goals are. And our goals are improved public safety outcomes for individuals and communities. And I think we are at the point where there is enough evidence that shows that the current system is not flawed, it's not broken, because it never actually worked. And we're having disparate impacts on people who need the most help. And if you start from there, I have this hope that if what you're prioritizing is community outcomes, then surely people will be able to approach these discussions with the humility that the current system is perpetuating the very thing they're afraid of. And I think we also need to take a look at the laws and structures that support the current system as well. There's a lot of attention on the practitioners, but there's not as much attention on the laws that expect the practitioners to enforce them. And the downstream impacts of even minor involvement in the criminal justice system that can lead to much greater involvement over time. So in another one of these community groups, we learned, for example, that people were entering into the criminal justice system at a very young age because they couldn't afford driver's ed. And here's how it worked. There's a requirement that an individual who was 16 years of age who wanted a license had to take a driver's ed program, but it cost a few $100. And the people who needed to drive at 16, who had to drive at 16, were the people who had jobs that they needed to support their families, and they couldn't afford the $300. They drive without a license, they'd get caught, they'd be cited over and over again, they couldn't afford to pay the citations, and slowly those criminal charges build to the point where they're just in the system and they identify as a criminal and their friends are criminals, and it all just compounds on itself. So I think orienting people towards the fact that we all have the same outcomes in mind, and the way that we're currently getting there just isn't working unequivocally. I think that's the way we've got to do it.
Yeah, I wish I could have maybe. Go ahead, Brendan.
No, go ahead.
No, I said I wish I could have a more optimistic view, but maybe I've been hanging with too many people trying to do police reform in Latin America. And when I started looking at this topic more than 10 years ago, my mentors were like, you're gonna have a lot of pain and frustration. And 10 years later, there's a little bit still in there, because unfortunately, I think that we have seen it is one step forwards and 2 steps backwards, right? Let's take once again Mexico, where like the president just decided to say this initiative where we are increasing the catalog of crimes that deserve prison time. Or let's see, for example, a president in Brazil that says like a criminal that is dead is better, and that police that doesn't kill is not police. So we're starting seeing all these waves, unfortunately, of tough on crime strategies that I think they're clouding the conversation around that this is a vicious circle that programs like LEAD could break, because we send someone to jail. Let's say that if it's for a longer time, then you might end up creating some other networks, or like it's been exemplified in Brazil, getting to gangs, or in Central America, and then they go out to the community, and then we're trying to invest money in trying to prevent gang activities in the communities, but then we jail them again, and then they get out, et cetera, or people who are only temporarily in jail, right? Like 2 or 3 days because of civic violations, like loitering or consuming substances in public. And then it's just tiring police officers because we are arresting. We can arrest our way forward. I think that should be one of the lessons. We need to prevent going that way. And unfortunately, I think at least on the Latin America, there are not that many cases where we are out of that terror trap right now. But that doesn't mean whether we should take out the finger on the point and drive the conversation forward.
Jaime, I just want to say,
I'll just.
oh, go ahead. I just,
No, go ahead.
I couldn't agree more with everything that you just said. And, you know, that sort of 1 step forward, 2 step back thing is something that we're struggling with here as well. And I was in a community meeting, and one of the pastors stood up and said, it might feel like we're taking 1 step forward and 2 steps back, but if we never took that step forward, we'd be 3 steps back. So let's go ahead and celebrate the wins, because it's still better than it would be if we weren't doing the work.
Nice.
No, I agree. Both of you guys brought great points into that. And I'll just try to put a cap on that conversation by saying that I think this is true where we need to be able to prove what's happening. One of the reasons why we need researchers and people keeping track of data. So when we're doing an alternative response, or when we're doing a diversion program, we can say like, no, we diverted all these people and none of them went out and killed somebody. Or yes, this happened. But if we didn't have this happening with the person, like if we didn't have a case manager working with somebody every single day of the week, something worse would have happened. Or, hey, guess what? You arrested this person and didn't divert them, and look at what happened. We could have actually done better. So I think we have to continue to answer that to the skeptics. And the more we get on the line,
and maybe following on that point, Brendan, I think that you put a word that we didn't discuss too much, but it's arrest. Not everything has to be arrest, right? I think we need to change that mentality of police that arrest solves everything, which is what Mark was kind of referring to, right? No, it's not always the need for everything. And that's something that we need to change the metrics of success in order to put, like what LEAD makes, for example, referrals are also a metric of success, and not only traditional, if I arrest 50 people, then I'm the best cop in the planet.
Absolutely. We should be counting diversions or notifications to other systems as better than arrests, because in truthfulness, we see punishment and coercion actually do more damage than a referral to other public health solutions. So first and foremost, thank you to the great speakers, Mo, Jaime, Sergio, and Natalia, Nahora. Thank you guys for joining us and all the work you're doing with Jaime. It's really appreciated. I want to thank everybody for attending. I really want to send some thanks to Nick Crofts and Melissa Jardine. They are getting some well-deserved sleep because it's in the middle of the night for them. I can't blame them for staying, not waking up in the middle of the night for this. The executive team that's taken part in this includes them, and also Mark Rapansky, Bill Stronach, and Tim France, who's also on here today, and then Kerry Hurst for helping put all this together. This has been a great initiative that's happened, and we are going to continue it. The next webinar is on GLEFA's website if you want to go to the link to register, but it is June 21st, and it is going to be Eastern Europe and Asia Pacific. And I'm not going to try to figure out time zones. So if you go to the GLEFA website to register, it will tell you what time that is. Terry, you probably know what time it is.
Yeah,
I'm sure you will be up no matter what time it is for it.
Yeah, so it's actually the 17th of June. Yeah, so you might have misinformation there. 17th of June, so it's 4 p.m. Bangkok time. So yeah, so please join us. As you say, it's one of 3. But yeah, we'll be sending out recording of this as well, in Spanish and English, just to let you know. All right, I'll leave you to do the closing then. Cheers.
Thank you very much. We're going to override everything that I misspoke about is going to be covered up so nobody on the recording sees me screw up. All right, all. Thanks, everybody. Stay safe. Stay well. Take care.
Gracias a todas y a todos. Chao.
Gracias.
Bye. Thank you.
Bye.
Thank you. Bye-bye.
Bye.